I would like to say all the dignitaries for kindle the lamp in a virtual manner. Thank you one and all for your presence. Now moving forward, now with the pride and joy, I invite Dr. Alka Tajani ma'am, Principal of Vibrant Nursing College and Secretary General of Nursing Scholars Society for the deliver welcome speech.
Good morning, everyone. Those who are present on this webinar, I want to tell you we are organizing such type of webinar when there is a day celebration or sometime a webinar which is a various topic. So today also we have organized a webinar on organ donation. It's not a celebrity, it's awareness for the people. If nurse will aware about organ donation and she will be aware to other also. So with this note, utmost gratitude, I welcome to Dr. Rita Dar ma'am. She is very much aware and she is working for the organ donation also. I know ma'am personally and ma'am is taking today's webinar as a speaker. So welcome you ma'am. Today's moderator, Professor Annam Rajkumar. At most gratitude also, I am welcome to ma'am. And all the participants, all the faculties across the country who joined the webinar, I welcome you all. What to access, sir?
Thank you very much ma'am for such a thoughtful welcome address. Now moving forward, we are going to start our session of webinar. For that, I would like to introduce our today's moderator, Ms. Annam Rajkumar ma'am. Ma'am currently works as a professor at Karpagam Nursing College, Coimbatore, Tamil Nadu. Ma'am has completed master degree in medical surgical nursing with subspecialty of critical care nursing and having a 13 year of experience in nursing profession. Ma'am currently pursuing PhD in JJTU. She has published research articles in referred national and international nursing journals. She has participated, organized and conducted many workshops and conferences at national and international levels. She also received many appreciation awards. She is a life member of TNAI and NSS. Now I request Ms. Annam Rajkumar ma'am to take a charge to introduce our speaker. Over to you ma'am.
Am I audible, sir?
Yes ma'am, you are audible.
Okay. Thank you, sir. Thank you for your lovely introduction, sir. Good morning to everyone. I really thankful to Dr. Binu Joy, President, National Nursing Scholars Society and Principals of Christ College of Nursing, Rajkot, and Dr. Alka Tajani, Secretary, ma'am, National Nursing Scholars Society and Principal of Vibrant Nursing College, Surat, and Mr. Bharat Gondalia, Administrative Head, Vibrant Nursing College, for organizing a wonderful national webinar on the occasion of World Organ Donation Day 2022. Never stop learning because life never stops teaching. If you are not willing to learn, no one can help you. If you are not determined to learn, no one can stop you. For continuous learning and upgrading of our knowledge, we all gathered in today's webinar. For this enrichment, here we are having such an eminent legend, Dr. Rita Dar ma'am. Dr. Rita Dar has done Master in Nursing from REK College of Nursing and MPH from JN. And ma'am was awarded a PhD by the Center of Social Medicine and Community Health, School of Social Sciences, Jawaharlal Nehru University, New Delhi, and recently in 2021. Currently, ma'am is a national mentor for the CHO mentoring project of CMC Vellore, NHSRC, and the Bill and Melinda Gates Foundation. Besides, ma'am is the advisor to the Kidney Warriors Foundations. Ma'am has more than 32 years of experience in various government organizations. Ma'am has contributed various articles on children, the elderly, and women, etc. Ma'am worked as a hazarded post for more than 28 years in the Central Health Education Bureau, Apex Institution of Health Education, under the Ministry of Health and Family Welfare, Government of India. Ma'am has vast experience in collaborating with national and international agencies like WHO, UNICEF, PHFI, ICMR, NDMA, VHAI, and NIHFW, etc. On International Women's Day, she was given an Achievement Award by HealthWire in 2019 for her work on women's health. Ma'am has Lifetime Achievement Award by Nursing Scholars Society in 2021. I feel more proud to be a moderator of your section, ma'am. Today, ma'am is going to present about organ donations. Over to you, ma'am.
Thanks for such a lovely introduction. It's wonderful to be a part of this organization, Vibrant Nursing College. I am really thankful to Dr. Alkaji, who has given me this opportunity to speak to you on this occasion on Organ Donation Day. So shall I share the screen? Am I audible?
Yes, ma'am.
Yes, ma'am.
Shall I share the screen now?
Sure, ma'am.
Yes, ma'am.
I would like to speak about organ donation and transplantation on this day, on 13th of August, which has been observed every year from 2013 onwards in India. See, organ donation, organ donation, you are donating organs to to do the transplantation surgeries. Otherwise, there is no need to donate organ. An organ transplant is a surgical operation in which a failing or damaged organ in the human body is removed and replaced with a functioning one. Sometimes it is not even removed. In case of kidney donation and kidney transplantation, the organ which is not functioning in the body is not removed. Instead, one more is placed, one more kidney is placed with the human body. The donated organ may be from a deceased donor or a living donor. I will talk about this, what is deceased donor and who is a living donor, in my later slides. Now, recently I have written a book. It's on organ donation. Having done my PhD on organ donation, I think when I was a student of REK College of Nursing, I was told that if you are not writing a book after your PhD, you have not done PhD. So I think that was somewhere in my mind, and I wrote a book on organ donation, and it has 11 chapters on different aspects of organ donation, what is living donation, what happens in the country. Now you can see that this green ribbon denotes, it is a symbol of organ donation. And I have taken all the three colors, all the colors of our national flag, because this book talks about India in the center of the globe, and taking, the global picture around and seeing that how India stands in organ donation in India, how India stands in organ donation and transplantation. And in nursing, you are taught about so many disciplines. You are taught about psychology, you are taught about sociology, research, so many things, medicine, surgery, ethics, legal aspects. You are taught about so many things. And if we are not able to write multidisciplinary book on organ donation after doing research, I think I have not done justice to the nursing profession. So I wrote a book on organ donation. It is for multiple disciplines. Whether a law students can refer to it, medical students can refer to it, nursing students, psychology, sociology, because it has brought all those aspects. Organ donation is not about donation. It's not a surgical procedure. It's not a medical procedure. It involves ethics. It involves sociology. It involves psychology. It involves philosophy. It involves public health. It involves laws. So I have written a multidisciplinary book on organ donation and transplantation. It is a textbook. And if your students want to do research in organ donation and transplantation, they can refer to my book and, pick out some of the aspects of organ donation and do further research. Now, it was really nice of Usha Uthapji having read my book, and she rang me after reading the book, and she really she sent me the photographs. And when she rang me and had a lot of appreciation for the book, and to tell you the truth, that she has a son who is on kidney, he's on dialysis, his kidney is failing, and that's how she could relate with the book. And she told me that you have done a wonderful book. She had poetry, she wrote some poetry about me, and it was really, so I had tears in my eyes when she unexpectedly rang me and talked to me and appreciated my book. You can see that the cheerfulness on her face. She's a legend, and I could never have thought that she would see my book and she will go through it and she will send me the photographs. It was really wonderful to see her appreciating my book. Now coming to, there is difference between body donation, tissue donation, and organ donation, and even medical students are not aware of this kind of a thing. Even nursing students are not aware of these kind of things. But if I am taking a session with you today, you should be knowing what is body donation, what is tissue donation, and what's organ donation. There is difference between these three things. It is not same. If you donate body, you are not donating body to donate organs for transplantation. If you are donating tissues, it is a different kind of death. And if you are donating organs after death, the death itself is brain death. So there are a lot of differences between body donation, tissue donation, and organ donation. Coming to next slide. Now you can see that organs and tissue. See, once body is donated, we have different laws for body donation. Body is donated to medical college. There is nothing to be removed from the body for transplantation. It goes intact to the medical college after death. After the body ceases to function, brain is not functioning, heart is not functioning, nothing is functioning, and you are handing over the body to medical college. They put it in formalin, and then the students do the dissection and do the study on this. They learn body function, body parts through this act of body donation. Now you can see that organs on this side and tissues on this side. See, organs means lungs, it means heart, it means liver, it means kidneys, it means pancreas, it means small intestine. All these organs can be donated after brain death. The person's brain is not functioning, but his body is functioning. He is on the ventilator, and when the body is on the ventilator, when the person is on the ventilator, the heart has not stopped beating. The organs are retrieved from the body and transplanted into patients. So for donation of organs after death means donation of organs after brain death, not complete death. Like heart has not stopped working, heart is working, and you are retrieving body parts. You are retrieving organs and getting it transplanted to the human bodies, human beings who need these for therapeutic purpose. So now on the other side, you can see tissues, cornea, skin, bone, blood vessels, cartilage, ligaments. These tissues can be donated after death. You may have come to know that many a times when a person dies, they give a call to the that retrieval centers, and then tell them that the person had wished to donate eyes. So corneas are retrieved after death, not after brain death. The person has to, for cornea, skin, bone, blood vessels, cartilage, brain death is not important. For these organs, the person's brain only should be dead, the whole body. If it is dies, these organs are not functional. So you have to understand the difference between organs and tissues and body. Body is donated for the scientific purposes. Organs are donated for transplantation after brain death, and tissues are donated after death, after complete death, bones, blood vessels, and other things. Now coming to next, we have different acts. We have in India, different countries have their own acts. India also has its own act. You know that there is a bill, the bill is passed, then it becomes an act. Then act is not complete in itself. After once an act is passed, we have to form certain rules. That is why we have Transplantations of Human Organs Act, THOA 1994. In 1994, we have passed Transplantations of Human Organs Act. And as I have told you, act is not complete in itself if rules are not followed. So we had formed rules, Transplantation Human Organs rules in 1995. And after a few years, we felt that there are some lacuna in the Transplantation of Human Organs Act and rules. So we tried to amend it, and now it is called Transplantation of Human Organs and Tissues Amendment Act, because tissues were also included in 2011 Act. And we, as I have told you, that after Act, we pass on certain rules. We have to make certain rules to make it, viable, to make it feasible for transplantation, feasible for the Act to, take place, Act to followed by rules. So transplantation human organs and tissues. We see, first we had only organs act, but in 2011 tissues were also included into this, and that is why it is called Transplantation of Human Organs and Tissues Amendment Act and Transplantation of Human Organs and Tissues Rules 2014. So latest we have 2014 rules about organ donation and transplantation. So organ donation by a brain dead person, organ donation by a brainstem dead. See, we have different definitions of death. We have brain death, we have brainstem death. All these definitions have different connotations. There are different diagnostic procedures, and India has brainstem death. It is not brain death, it is brainstem death. The organ donated by a brainstem dead person was made legal in 1994 when Parliament enacted the law named as the Transplantation of Human Organs Act 1994. The THOA, as has been in place since February, see, once it is Act is passed, so there is notification of this Act, and Gazette notification is there. So it is there in Gazette notification from February 4, 1995. Now, what does this law say? This law provides for regulation of removal, storage, and transplantation of human organs for the therapeutic purposes. So this law is not for any other purpose. It is not for scientific purpose. It is only for therapeutic purpose, means it is for treatment of the patients who need organs and nothing else. You can't retrieve organs after brain death for doing some research. You have to do it for therapeutic purposes only. You have to do it for treatment purposes of the patients. So, and it has to be done for prevention of commercial dealings in human organs, for matters connected therewith or incidental thereto. So you can't do any commercial activities with these organs. So this retrieval is only for transplantation, not for scientific purpose, not for educational purposes. So this organ transplantation has its own rules and regulations, and it tells us that this kind of activity other than transplantation is not possible if you are removing organs after brain death. So awareness and acceptance. Organ or tissue donation as such is not a new concept. Most of the people are aware of kidney donation from the live donors. So living donors, most of the time you may have seen that, you may have come across certain, media reports that nowadays I have seen, I went through so many newspapers, and they write that sister donated kidney to brother, sister donated liver to on Raksha Bandhan. Usually the brother has to protect the sister, but sisters are protecting their brothers, and they are donating, they are gifting their vital organs for the survival of brothers. They are gifting their organs for the survival of their children. They are gifting their organs for the survival of their spouses, children. So most of the people are aware of kidney donation, from the live donors or eye donation from the dead ones. So for them, eye donation is organ donation, but eye donation is tissue donation. You should understand that eye donation is not organ donation. Eye donation is tissue donation and can be done after death only. Eye donation is not organ donation. You should take this message. If somebody tells you eye donation is organ donation, but in Indian context, eye donation is does not amount to organ donation. It is tissue donation. Organs of a completely dead person are not fit for transplantation. If a person is completely dead, his heart is stopped functioning, his organs are not viable. So only tissues can be retrieved. Organs cannot be retrieved from a dead person. So you should understand the difference between organs and tissues. Now, give life or improve the quality of life or do both. Organ transplant is a life-saving measure in case of organ failures and human beings. So, the organs have failed. Sometimes liver fails, sometimes heart fails, sometimes, kidney fails. So, person is dying and the relatives or a brain-dead donor donates kidney to save the lives of the people. So, it is a life-saving measure. But tissue transplant is, in most cases, is crucial for patients suffering from different physical disabilities and improves their quality of life. See, eye donation is not going to save a person, but it is going to improve the quality of life. Bone donation is not going to save the life of a person. He is safe, but he's not able to move around properly. He is deformed. So it is basically to improve the quality of life. One more difference is that organ transplant saves lives. Tissue transplant improves the quality of life. That is the difference between these two donations. And there are a lot of differences. I have made a big chart in my first chapter on organ donation in my book on organ donation on multidisciplinary perspective. The first chapter talks about different laws, different things about organ and tissue donation, organs, tissue, and body donation. So it is giving a complete picture. There are so many differences between organ, tissue, and it has really done. I have done justice in that first chapter on organ donation, and in my organ donation, body donation, and tissue donation in the first chapter of my book. Next is beneficiaries of tissue transplant. See, skin transplant is needed for victims of severe burns. One more important thing about tissues is that tissues are stored in tissue banks. Like we have skin banks, we have heart valve banks, we have bone banks, we have corneal banks, but we do not have organ banks. Organs cannot be put into the banks. Organs are to be transplanted immediately. They can't, if suppose you wait for long, they perish. Skin can be they are placed in skin, that cornea, bones, they are put in bone banks, tissue banks, and they can be used till 5 years. Some of these tissues can be used even for after 5 years of their retrievals. But that is not the case with kidney, liver, or heart donation or lung donation. They have to be transplanted immediately. That is why we do not have, nobody has, nowhere in the world till date, there is no organ bank. We have only tissue banks in our organizations. Now, skin transplant is needed for victims of severe burns. It covers the skins and it enables the skin to heal underneath. Now, people suffering from blindness because of eye disease or injuries can benefit from corneal transplant. Bone transplantation is used to cure patients suffering from bone deformity due to aging or other birth defects. It can also help victims who have to undergo amputations and accident victims whose bones may have got damaged beyond repair. That bones cannot be repaired. Only transplant will help in repairing the bony part. Now we have legal options. You may be thinking that we want to donate organs. Yes, you can do it. You can opt in pledge for. You can pledge to donate organs, but you can also tell your families that you would like to donate organs if you are, declared brain death. I have told you organs cannot be donated without brain death in India. So we have opt-in system where you can pledge to donate organs. We have we have national organ and tissue transplant organizations. We have they make you to pledge organs. There are many organizations. They will give you some forms and you have to fill up the forms, and then in that form you have to give your option whether you want to donate heart, donate kidney, donate liver, donate this, donate that, and you put tick mark. But there is opt-in option in also in our these driving licenses also. Like recently I had applied for driving license. It was renewal of my driving license. There was an option, would you like to donate organs? Without giving an understanding what is organ donation, tissue donation, they simply want you to say yes or no. People think that it is eye donation, but it is organ donation is different form of death. So you may by default, you may write yes to organ donation, but maybe you are not aware of organ donation also. So we have mandatory choice in driving licenses. We have mandatory request. Like the doctors or nurses or organ transplant coordinators, it's mandatory for them to request people to donate organs if they are, declared brain dead. So this is mandatory. This is mandatory option. Then we have mandatory OTC, organ transplant coordinators. Every hospital who is doing transplant surgery should have organ transplant coordinators to, motivate the grieving family to donate organs when a person is declared brain dead. So one more option is their mandatory brain death declaration. I will not go into depth about this. Then I will have to talk about what is brain death and so many things. I need one more session for this. What is mandatory brain death declaration? So there are so many issues to it. So let me not talk about this and confuse you more. So right now, India is working on opt-in system. Like you have to give an option in driving license, or you have to fill a pledge form. And it is also not required to do so. Your family, without you giving an option to donate organs, can donate organs if without your consent also. It is not that your consent is always important. People think that if I have not pledged to donate organs, my family cannot donate organs or tissue. But that is wrong. Even if you have pledged to donate organs, your family can still say no to organ donation and transplantation. So there is opt-in system right now, but people are thinking of going to opt out like Spain. But it has opt-out means even if you have not pledged to donate organs and you have not simultaneously shown your, you have not accepted to donate, like you have not declared somewhere that you would not like to donate organs. So that means it is taken for granted that you are willing to donate organs. So it is a very coercive option. It is a draconian option, and some people, without understanding what is opt-out system, they pressurize India to go for opt-out system. That means if this option is working today, all of us, even if we are willing to donate our organs or not, we have pledged to donate organs. So it is opt-out system. If you have not opted out of organ donation wish, so that means you have opted in. That is, people are thinking that we should also go for it, but right now I don't think this will be sane option to go for India to go for it. National organ transplant program. So we have it's really sad to know that we read so many of national programs. We have a national organ transplant program has also been started by Ministry of Health in 2009, but so far I don't think it is in it has been dealt on very well in public health books. And from 2010 onwards, India has been observing National Organ Donation Day every year in the month of November by creating awareness about the topic, arranging seminar, and etc. Now, you may be thinking that why I am saying November. It is Government of India. Government of India is observing this day in the month of November, usually 27th November, because I have worked with Government of India and I know I have been involved in this organ donation day, and I have been doing this research in Apex organization NATO, and I know that from 2000 onwards, India has been observing National Organ Donation Day in the month of November. Now we may be thinking that why today? This day is celebrated by observed by Times of India along with other Mohan Foundation and other organizations from 2013 onwards. So they also make people to pledge to donate organs, and what happens to those pledges, we never know. But they have started this initiative, Times of India initiative from 2013. And over a period of time, people have started thinking that it is World Organ Donation Day, but it is not World Organ Donation Day. It has been started by Times of India and it has been percolated as if it is World Organ Donation Day. It is not World Organ Donation Day today. And in fact, India is observing Organ Donation Day twice, in the month of August and in the month of November. And again, there will be in the month of November, Ministry of Health and other organizations all over the country, ROTOs will be observing this day in the month of November. So what are the types of donors? There are two types of donors, living donors and deceased donors. Living donors can be related, your spouse, your related donors, there is definition of who can be related donors, who can be unrelated also. Your friends can also donate, but they go through different processes. Scrutiny is very difficult. Related donors also have to, they have to go to competent authorities. They see that whether there is genuine relationship, whether the donor is, whether there is any coercion on the donor. And if there is no coercion, then only the person is supposed to donate organs. Otherwise, the authorities will not allow organ donor to donate the organs. Unrelated donors can also donate, but they should have love and affection for the donor, for the recipient. Now, deceased donor, living donor can donate only a kidney, one kidney, or a part of liver. But there was a woman who had donated liver kidney to her husband a few years back, and then afterwards he needed a liver transplant. Also, she donated half of liver, and both were doing well. So only liver and kidneys can be donated. Kidney can be donated, a part of liver or one kidney can be donated by but deceased donor, brainstem donor. Deceased means circulatory death and brainstem death. Again, this is different. There are 5 types of circulatory death and brainstem death or brain death. There are again 2 types of deaths, brainstem death and brain death. Brainstem death is, the procedures are different to diagnose this kind of death. So brainstem death has been adopted by India also. Not all countries have adopted deceased donation. Some countries have only living donation in their countries, but they do not allow deceased donors to donate organs. Some countries they do not have neither living donation nor deceased donation. Some have both. So India has both living donation and deceased donation, but we have not yet, formed framework for circulatory death. It is different kind of death. Again, I will not go into details about this. My book talks about all those things if you want to go through that. Now, there are a lot of confusion which has not been cleared by even Times of India initiative on organ donation. When we make people to pledge eyes, we are primarily talking about donation after death, about which people have no problem. But when we want people to pledge their kidneys, liver, heart, lungs, or pancreas, donation in India, we're talking about brainstem death. That means organ donation is linked with brainstem death, and brainstem death is a new medical legal definition of death, for which people may have a number of questions which need to be answered first before they pledge to donate organs or they fill pledge forms. Next is introduction to concept of brain death or brainstem death. Brainstem death or brain death is a new medical legal definition of death. Its main purpose probably is to popularize organ donation. Brain dead person is dependent person who is breathing through a ventilator. One can feel his pulse, blood pressure, and other signs of life. Brain death holds that the lack of functioning of the entire brain is the truest signs of death, and that the rest of the body will soon stop functioning, even if the ventilator is continued. Brainstem dead person appears to be alive because he is sustained by complex technological innovations which enable him to breathe and make him want to touch, take fluids, and other forms of nutrition. Now you can see this. He is my, on WhatsApp group. He is a man whose wife donated liver to him. Ek jigar do jaan hai hum. There are two people. There's only one liver between them. They are working on both of them. This lady, she is his wife, and she donated liver to him. And after donation, she delivered a child also. So you can donate safely about 65% of your liver to the recipient. So he's so happy. He always talks about organ donation. It's a new life. It is no. He's a post-transplant child. She is pre-transplant child. These kind of things he's always talking, and he feels so elated that he is living even after 10 years of liver transplant surgery. Now you can see this lady. She is holding my book. She is a liver transplant recipient. She got a liver from a brain dead donor, and when she came to know that I have written a book, she felt that I have written her story in my PhD thesis, and she purchased this thinking that there will be that story, but I will be writing her story in my next book on organ donation. So this is first book, this is textbook, and in second, gender issues in organ donation, I will be writing that also. Now you can see that REENA Raju, heart recipient, she had her own heart. It did not work for long. About 21-year-old she was when her heart failed. So she received another heart from brain dead donor. Then it did not work for 5-6 years. Then again she had one more heart. So she has changed 2 hearts, and she is living on 3rd heart. So you can see that how, yesterday also she was talking somewhere, and with full, confidence and without any, sign of tiredness or something like that. She was talking about her journey as a heart transplant recipient. She got heart twice from a brain dead donor, and it's really wonderful seeing her doing well even with 3rd heart. Now you can see Asia's first upper arm double hand transplant recipient. Now you can see this girl. You can see her hands. See, male hands. She was transplanted from this area. You can see the color also. There is difference in color between this portion and this portion. She had, amputated her both limbs because of some accident, and she was not able to, when she relates her story, it is really pathetic to know that she says that it was really difficult for a grown-up girl to call her mother to tie her, that nada, so that she could save herself from shame from others. So she had these 2 hands up to this from a male donor who was a brain dead donor. And now when she has started writing, she thinks that the way I was writing before this, she had this amputated limbs. So she has started writing the same way, the way she had been writing previously. And she feels so happy that she can hold her cup of tea on her own. She can take food on her own. She can tie nada on her own. She can do a lot of things on her own with 2 hands of a male donor. For her, this is the most kind act that donor has done. And donating these organs, it takes a lot of courage from parents, from family members to donate organs of brain dead donors. So my opinion on brain death or brainstem death, organ retrieval from brain dead person can be equated with evacuating assets of a house that is on fire. Once a house is on fire, that the house will perish. What do? We just remove the assets from the house. The TV and other things, we remove those assets so that at least we are saving those assets from going waste. And there will be a lot of things on the floor near to the house that is burned, because you want to save something from a house that is on fire. So it can be equated brainstem dead person or house's organs that could go waste in a short duration of time, or could give life to a number of people dying dying patients through organ donation before death occurs. So that is all about organ donation. And thank you. Now, any questions, please let me know.
For the participants, if you have any doubt, can you please ask? Any queries from the participants?
You can write also. If you don't feel like asking also, you can write the questions also.
You can share your questions in a chat box. The participants can share your questions in the chat box.
Yes, Meena is asking some questions. Yes, you can ask. Meena, you can unmute yourself and ask question.
Yeah. Good morning, madam. Dr. Rita and all nurse respected members of Nursing Scholars Society. It was a awesome, amazing information, madam. It was a powerhouse kind of thing. I did not know that tissue is different, bone is different, body is different, and only after brain death. Means I just want to ask that only after brain death one can donate the organ, not before that.
Yes.
Yeah.
Yes,
You
yes,
really
yes,
very nicely informed. Was so informative, so much knowledgeable, and it added, really this kind of awareness is very important in people, because even I, being a nursing personnel, retired personnel at the age of 61, did not know about these laws. 2009 laws, 2011 law, 2013 onwards, what came into existence, and how Government of India initiated this, but it was not approved, and it is celebrated in the month of November. It's not today, but in India today also, and because we want to make the more and more people aware about it.
Yes,
And
yes,
one more thing
yes.
I liked about it, that when you meet with an accident, so that form is asked when you're driving.
Yes.
So every driver should be made aware about it, that whether you would like to donate or not. And then consent is not needed also, because I have pledged for organ donation, eye donation. I have the forms with me. I have given it to my relative also, and I always carry in my purse, because I was in so that time the campaign was there. So that information is very good, kind of thing. Like eye donation is not organ donation. Eye donation is separate from organ donation.
Yes, yes,
So
yes,
this
yes, yes.
clarity was very much essential. I myself did not know so many things what you noted down, and I would really purchase this book and possess with me and refer as and when required and spread awareness. So
you can do a lot of things. I also feel it is not. Yes. Please continue. Please continue.
I want to ask one more thing. Like, suppose if I do not pledge, or I do not write anything and submit it to my relative, but if they want to donate, my brain is dead, but my heart is good, my liver is good, my pancreas is good, my kidneys are functioning. So can they donate?
Yes, they can
Without
donate.
my
They can donate without your consent. That is why I told you there is no need to fill up this form. Your family can still donate. I have, I interviewed 16 donor families. Only one girl had pledged to donate organs. Rest of the 15 donor families had donated brain dead donor organs without the written consent of their donor. So it is not must for you to pledge to donate organ. Family can decide on their own.
One more question, madam. I'm very sorry to take your time.
Yes.
If the person is of 90 years old, already osteoarthritis and all these problems, but still wants body to be donated and given the consent, 90 years old. So can that donated body be used by medical students for their learning purpose? Because by 90 years, all the organs are, shrink and somehow stop functioning. Do you feel that way? 90 years old.
Yes, they can. They can. It depends upon the policy of the government college, these medical college, whether they take. See, sometimes I would tell you one more thing. Even if you are pledged to donate organs, bodies, tissues, and you know what happens, family feels that it was last wish, and they get desperate when organs are not taken or when body is not taken by the medical college. You should tell your family members, if the opportunity comes to donate organ or body, so you can donate, but you should not feel, you know, they feel that we are doing something a sin because we are not taking, you know, that last wish of the person into consideration. So that is possible sometimes, you know, because of certain diseases, even body is not accepted. Because of certain infectious diseases, not every time the body can be donated. But you should always tell this thing also to your family members. I have pledged, but don't feel bad, because I have seen families feeling devastated when they are not able to donate bodies of their family members because they feel that it is their last wish. But that is where we have to tell them it could not be possible also. So that is, and it depends upon the condition of the body. 90% can also, sometimes, you know, it depends upon the condition of the organs. Organs as functional, you know, basically it is anatomy which they are learning from this. They can learn from this anatomy from the 90% old, because he has all the organs also. So again, it depends on the policy of the medical college, whether they take it or not.
Thank you so much, madam. It was amazing.
So
Thank
nice,
you for
so nice.
Thank you.
So nice. Thank you. Yeah, see, one more thing. It is not only nursing professionals are not aware, even medical professionals are not. Sometimes, you know, I have seen that people from mortuary have been calling in auto people to take the organs. The person has come to just now death has taken place. The family is willing. Mortuary, you can't donate organs in mortuary. You can't donate. The person is in the ICUs. These are ICU-linked deaths. These are ICU-linked that the person is in the ICU and he's on the ventilator. He is not in the mortuary. Nothing can be taken in the mortuary except tissues. I have told you tissues can be taken, but organs cannot be taken. So it is not, knowledge is not only that nursing people lack knowledge, it is also the medical professionals also lack knowledge. So this book is one of its kind in India, because I have done a lot of research work. I have found everything in organ donation and transplant. It was like my guru mantra. So I have related organ donation with marriage of a daughter also. How new organ comes into, you know, body and it doesn't accept it, you know, then it takes time to get adjusted with the new body also. So I have worked a lot, and I am really happy that you are appreciating my work. Thanks a lot. Thanks. Thank you.
Thank you, ma'am.
Any questions?
Yes, ma'am. One more question from the participants. Name is not mentioned in that, ma'am. How much time we can retrieve tissue from the dead one?
6 hours usually. 6 hours. 6 hours usually, not more than that.
Okay, thank you, ma'am.
Madam, one more question. Madam, it was a very good presentation done by you. We got a knowledge, and my question is like, can you just brief out that point which you missed, that majority, like mandatory organ donation act or rule?
Mandatory organ donation, mandatory declaration of brain death. I did not talk about that. Otherwise, mandatory request, I told you that it is mandatory for a nursing professional to you know, to request families to donate organs or donate tissues in case of death. It is mandatory. Even then I had told you one more, that mandatory organ transplant coordinator. No hospital can retrieve organs if they do not have organ transplant coordinators. These organ transplant coordinators are either nursing professionals or medical professionals or sociology professionals. They are trained for 5 days at least, and they have to be organ transplant coordinators. They you know, counsel the families to donate organs. See, donating organs of a brain dead donor who is on the ventilator, who is breathing, who is having pulse, who is having everything. It is not an easy thing for family also. They feel they're trapped. They feel there is some racket going on in the hospital. They feel that why they are asking us to, donate organs. So we have categorically written that it is their, it is mandatory for them to request to donate organs. It is not that they are doing on their own. It is mandatory for them to request to donate organs. In fact, that format was created by me only in Ministry of Health, how to, pacify people that when they are asked to donate organs of a brain dead donor, because it is not an acceptable form of death. They feel that the person is still alive. So that is, organ transplant coordinators have to donate organs. And then there is one more, I told you, mandatory choice in, a driving license. There is a mandatory choice. Maybe some of you have filled also without knowing what organ donation is. And then there is mandatory donation, a mandatory declaration of brain death. You want to know that? Do you want to know that? See, there were people without declaring brain death, they would ask patients to donate organs, and then only they will declare death. See, this brain death is declared twice. And after declaration only, they should ask people to donate organs. But what used to happen? Without declaring brain death, doing the preliminary tests for the for apnea test, they would see that what is the condition, mental condition of these patients, whether they would relatives, would they donate or not. Before that, before declaring death, brain death, or before writing that he has, before doing tests for brain death declaration, they would ask relatives to donate organs. So now they have made it mandatory that you have to declare brain death, then only you will ask relatives to donate organs. So that is how what I am telling, mandated declaration on brain death for requesting relatives to donate organs. Not that before you declare death and then you ask for organ donation. And then don't declare if they don't go for organ donation. Anything else?
Any questions from participants? Any questions?
So how was the session?
Ma'am, really it was a wonderful sessions, ma'am. Now we are having the crystal clear about that organ donations and what are different kinds. And clearly you stated that organ donation, it will be saves the life, and tissue, it improve the quality of life. And what are the acts there in that India, that is what is THOA in 1994 and what is THOT. So now we all are having the crystal clear about that organ and the tissue donations, ma'am. It was a wonderful session. Thank you so much to you, ma'am. Thank you so much.
Thanks a lot. Thank you. Thanks a lot.
Thank you, ma'am.
Thank you, Meena. Thank you. Okay then.
I want to tell you, Meena Patole ma'am is a very active member in NSS, and so many times.
Oh, that's so nice.
Yeah. So every time she is sharing some of the thoughts or some of the topics on a Nursing Scholar Society group, ma'am.
Meena, you can take it further. This organ donation needs to be taken further.
Sure, ma'am. Sure, I will do whatever is in my capacity. Sure.
Yes. We can do a lot of things on this. We can do a lot of things on this. We can think about this and go ahead with this. I need people like you.
Sure, madam. Sure.
Like Alkaji, like you. We could do a lot of things, and because there is no awareness on this. And my guides are so happy to see my book, and it was really wonderful. Pleasing the JNU faculty is not an easy thing, but they are so happy that I did a lot of things with this.
Of course, we are so proud of you, madam. We are very proud that from nursing fraternity, somebody is coming forward and doing this great job, whereas doctors even do not know. So I will share this knowledge and spread awareness amongst the doctors now.
Yes, you do it. You do it. I can also help you in a lot. Yeah, I can help you in this. We can do it together. We can do it together also.
Yeah, we can do it together for them. Yes, Nat. Thank you so much. Thank you.
Thanks a lot. Okay, then. Bye.